Halio Dalio DND Family, it's your girl that answers to three names, and those are Davena, Nancy, and Davena. Right. Welcome back to the channel. We know, we don't need to say it, but we know. I'm just here to give you the updates on the module I did in year 3 because there's it any on my channel, and that is so unlike me. Usually as a semester finish, I do one video, but child, life. I'll be talking about the modules I did in year 3 semester 1. If you're interested in those details, continue watching the video. If you're really not interested in this type of video, but you just want to support me, the girl with 3 names, please continue watching, and thank you. So as usual, you know that I'm gonna write my stuff down to just keep track on the tab about unnecessary stuff. So let's get into it. So in year 3 semester 1, I did 6 modules in total. Health information systems, we did research methodology, we did adult nursing 1 and 2, we did psychiatric, mental health nursing, and we did pharmacology 2. Let's talk about health information systems. Health information system is basically a module that, while editing this video, I realized that I did not give a good explanation of the module, so we're gonna read the module description together, guys. So this course is concerned with the systems for the collection, storage, processing, retrieval, analysis, dissemination, and communication of information related to the planning, provision, and evaluation of public health services and the general state of the health of the community. The use of computers in data management will also be explored. The course has been divided in the following units: basic concepts of information systems, structure and essential components of the health information system, the notifiable diseases / health event surveillance subsystems, measuring and monitoring the health of the population, analysis and the presentation of public health data, and critical issues in the operation and management of the health information system. There was a lecture portion and also a lab portion to this module. Once you follow in class, pay attention, and if you have any concerns, you voice it to the teacher, let him help you. It should be okay. It should be a manageable course. As it regards the test portion, that was that for health information system. For research methodology is basically a module that teaches you about the basis of the research process. They tell you about the different parts, the different strategies, the different components, what is qualitative data, what is quantitative data. There was a lecture portion and there was a tutorial portion. In the tutorial portion, our first work that we did was an individual assignment. You're going to choose a topic based on your discipline. So I'm in nursing, so I'm going to choose a topic that is relating to my discipline. So I chose examining the financial strain cancer has on families. They're going to tell you what a topic comprises of, how to come about getting a topic. Don't worry about that. I'm going to teach you about it, okay? And then you're gonna have to do a background on the topic that you chose. After the background, you're going to do a problem statement based on the topic that you chose. After that, you're gonna have to do a purpose of the study. So this individual assignment is having these different parts. You get your topic, then you do your background on your topic, then you do your problem statement. After your problem statement, you're going to do the purpose of the study. Why are you carrying out such a study on this particular topic? They're going to teach you how to come about getting that as well. After that, they ask us to do at least 5 research questions. To do your research questions, you're going to do the significance of the study. What is the importance of this study? They're going to ask you to do some definitions, to just define some words that we think the general public might not know the meaning for. This individual project will comprise all of that. You're going to find your topic, you do your background on the topic, you do your problem statement, you do your purpose of the study, significance of the study, research questions, and your definition for some terms. I was having a hard time. Listen to me. First semester year 3, Bro, let me just tell you about our research methodology. Drop down a piece at all those for me. So when I tell you, say, we got some boobs. I had a lot of problems in year 3. I don't know why. But we never yet have problem like admissions problem with UTEP before. Never. Until year 3, of course. So I'm gonna go some boobs. Everybody can choose their modules. I wasn't able to, and I was unsure as to why. Because everything paid out. For them exam them, my grade them come up, everything. So wagwan. Went up by the school, them up me back and forth. If you know, you take, you know. Just to understand that I was not progressed. Okay, I was not progressed. All right, can you get that done? Just to understand that when I did my 10th step, they did not record that. So it's showing that I did not enroll for my 3rd semester. Problem. Anyway, they fixed that. They fixed it. I went home and I chose my modules. When I was trying to choose research methodology, spaces were filled. I couldn't choose. The whole of the class them full up, me can't get in. You know, it's another stress that. I got some hopes. Email the necessary heads. Email me, rep, and you know, go through the necessary different commands and so forth. Child, them tell myself I can't if you just go to class them, because this might take a while. They had to request space for us. Them request space by the time if you select the space them gone. So me stress again. They had to create another class that I went into. Thanks be to God, because bro, thank God I get to do the module, pass it and everything. I'm grateful. I'm very grateful. Anyway, research methodology. There was a tutorial portion where we were placed in groups of 5. So it's that individual project that everybody had to do. When 5 students come together, we had to choose one of those topics. And it's those 5 research questions. Yes, they will be split up amongst the students or amongst the group members. So maybe I get question 1, you get question 2, and you do your research on it, find your information, write basically a paragraphs. You won't be carrying out research, you're just going through the stages of the research process. But in the group, whatever topic that we chose, we had to do a literature review on it, and we had to do a proposal on that particular topic. They'll teach you how to do this. They'll teach you what it comprises of. So don't worry about it. There was no final assessment. Thanks be to God. So all we had to do was the 1 individual project, 2 group work, you know, the proposal and the literature review. We had 1 mid-semester but no final exam. Very challenging. They are challenging. So nobody feels that some little dibby work. No. But at least we don't have a final exam for bust a brain pan, right? Yeah. Let's move into my favorite parts of these type of videos. You know, the nursing modules, the core modules, because I want to be a nurse. So teach me about nursing. So let's start with adult nursing 1. The module description reads, this course focuses on adults between the ages of 20 to 64. With acute and chronic health conditions. The course will cover common health conditions of the region and will include topics of all pathologies. The emphasis will be on providing holistic care using the nursing process. The units that we did, or the systems that we did in this module, Adult Nursing 1, were respiratory system, cardiovascular system, hematology. If you're a nursing student, must know that's blood. But if you're not, it's blood. Lymphatic system, renal system, musculoskeletal system, and venipuncture. So basically, I say layman term, you are going to learn the conditions of these systems. What are the pathophysiology, the signs and symptoms, which are basically the clinical manifestations of a particular disease in a particular system. You're going to learn about how to diagnose it, what type of labs you're going to use to diagnose this and that. You're going to learn about the management the treatment, the nursing considerations. It will be a lot. Let me tell you, the content of this module will be all E. You see, if you pay attention to AMP1, AMP2, and pathophysiology, it basically them are reiterate information. We had a lab portion for adult nursing 1, so you're gonna have to go to lab classes weekly. For the test portions, we did 2 group assignments. We had no lab assessment. So what added up to our scores for lab session was basically our attendance and our redemonstration to the teacher. What they did was each week you come, they teach you the skill, and you being there, seeing the skill, and you redemonstrating the skill to the teacher to show your understanding of it. Then there was a final exam, and that was face to face. Adult nursing 2 no. Adult nursing 2 is basically part 2 of adult nursing 1. So it's a course that tells you about health conditions in adult patients 18 to 64. The systems that were covered under this module were diseased conditions of the nervous system. We looked on the sensory system, specifically ophthalmic, auditory, and integumentary. So you know that the eye, ear, and skin. The endocrine system, gastrointestinal systems, disorders of sexuality, reproductive systems, both male and female. Basically tells you about the pathophysiology of these disease conditions, the signs and symptoms, the how you diagnose it, how you treat it, how you go about as a nurse managing it, and what are your nursing considerations. We also had a lab portion. This one we did have a final lab assessment for. For the test portions, we did 2 group work, we did 1 mid-semester test, and we did 1 face-to-face final exam. And don't forget the lab examination. We're going to move on to psychiatric mental health nursing. So psychiatric mental health nursing, it's basically teaching about mental health, mental disorders, how you as a nurse can manage mentally ill patients or patients who are displaying mental instability. In order to learn or know how to manage these persons, you have to learn about the different personality traits, different personality disorders, the different personality styles, how to communicate effectively with these persons who are displaying these abnormalities. We also looked on how can somebody social issues or personal issues affect their mental health. So that's why you can see people smile on your face and behind closed doors or in them head, something is happening up there. Okay, they also taught us about depression, anxiety, self-esteem, defense mechanisms, coping strategies, whether that are maladaptive or adaptive coping strategies, learning how to assess somebody's mental health status. It is just like in first year when I just learned how to do head to toe assessment, but I just the pan road and just assess people. So without them permission, without them knowledge. When I learned about the mental health status examination, somebody might just say something and I'm like, yeah, that one are definitely delusional. This one have homicidal ideation. Bro, doesn't stop. Since someone start control, I'm say, alright. You cannot be going about your business diagnosing people. That's not right. Had to get a grip. That mental health status examination though help you to find out where is the gap in this person's mental state. When you learn where that gap is, then you'll be better able to assist with helping them to overcome the challenge. I love the module. I ain't gonna lie to you. I looked forward to that class every week. Chef kiss, love it. The reason I think I liked this module was I always wanted to become a counselor. Me don't know why me feel like me need to go in a counseling, but me just feel like me did have it. I thought I had it when it come on to advices. I thought I had it when it come on to know listening to somebody, understanding them. If they need to vent, they vent. If they need me to give them advice, I give them advices. If they need somebody to comfort them, I am there. I just thought I had it, and I was like, yeah, counseling is for me, counseling is for me. But I don't know, bro. I don't know. But just have to wait for the specialized nursing first to see if it's really for me, because we just have to explore the others and see if it's really counseling. You understand me? Our teacher would not let us go without talking about schizophrenia. We zeroed in on schizophrenia because, best believe it, there are a lot of schizophrenic persons in Jamaica. Persons who are mentally unstable in a plain clothes. That's definitely shed some light on how to deal with persons who are going through mental challenges. We did one mid-semester test. We did one individual project. The individual project was basically like a case study where we had to go to Bellevue, get a patient, assess them, look on their docket, write the necessary information based on the headings that the teacher gave us, and just come back and do a case study upon them. We did one group project. It was a presentation, and we did one face-to-face final exam. Then for the final module that we did, it was pharmacology 2, and we did pharmacology 1 in year 2. So I'm kind of familiar with pharmacology. You don't know what pharmacology is about. It's nothing new. It's just that different systems in pharmacology 2. Pharmacology 2 is way harder though. It's more challenging. The system that we did in pharmacology 2 were cardiovascular system, renal system, central nervous system. We did the reproductive system, skeletal system, microbial, chemotherapy. So they did antivirals, antifungals, and antibiotics. We also did toxicology and cancer chemotherapy. Of course, they're going to tell you about the classes of the drugs, mechanism of action of the drug, side effects, adverse effects, therapeutic effects, contraindications, nursing considerations, and the management of patients on those particular drugs. So yeah, we did 2 in courses. So we did in course 1, in course 2, we did a group project, and we did 1 face-to-face final examination. And that comprises the modules that I did in year 3, semester 1. Let me give you no advice, and me need to take the advice too. Yeah, we come with a plan every year. Say, all right, we are going to stay on top of things. We're going to make sure, say, we do study timetable, we do study schedule on the weekends or whenever we get the free time. We study, ensure that we are grasping what we learned in last week to go into the new week, so we are not lagging or anything like that. Take the advice, okay? Read your past week notes before you're going to the new week. Understand it, because I tell you, if you wait for one time in-course time come around, if you wait for one time test time come around to cram it, it's gonna be hard. It has been hard. You just have to go. You just have to have God. It actually can pass you. And as well as the third year is going to challenge you. Third year semester 1 is going to challenge you. I'm gonna never somebody have extra responsibility why challenge me so, but my friend them say challenge them and them never have no extra responsibility. So yeah, it's going to challenge you. I'm not telling no lie. If you don't study any other module before you go into the new week, make sure you study pharmacology. Read it up, go back to the lecture. If it's gonna be online classes, go back to the recording, make your notes, do your necessary researches. I implore you to do it. If this video was insightful as it regards the details on the modules I did in year 3 semester 1, don't forget to leave a like on the video, leave a comment, and I appreciate you. Listen, I don't understand how much I appreciate you all. I'm gonna not appreciate me too, Big up on yourself. Big up on yourself all time, every time. So until the next video, stay safe, stay blessed, and big up on yourself. Bye bye.